Hello and welcome to another edition of Currently in Quincy. I'm Joe Catalano. On today's program, we will chat with Pat McGovern and Julie Abuzaid from South Shore Health's Mobile Integrated Health Program. It's all part of National EMS Week this week. First, though, we do check the news for you. Quincy Mayor Thomas Koch says he'll explore using some of the $34 million that the city's getting from the Federal American Rescue Plan to create a new home for Quincy College. This week, the mayor withdrew his request of the city council to borrow $23 million to buy the Monroe building in the face of city council opposition. He says he will look at other alternatives.
Well, I still think it's a possibility going there, but we'll just perhaps use other funding sources. The concern seemed to be, one or two had concerns about the future of the college, but I think a number of the folks were just concerned that the Quincy taxpayers were going to be footing the bill for this. So we're looking at some other options, Joe. If we can see if we can find some federal money, some state money to assist us with the project. So we'll, we still could end up there. Mm-hmm. We might be somewhere else in the square, but I'm still a big believer in it. If we don't do this, I think the college will be out of business in the near future. I think it needs a home. I think it needs stability.
Koch says he believes Quincy College needs a permanent new home in order to succeed. Some city councilors said the college governance needs to be examined before making any major investments in the school. Quincy Mayor Thomas Koch is expected to announce a new 9-member volunteer committee to examine issues of social justice and equity. This week, Ward 4 Councilor Brian Palmucci expressed disappointment that the mayor did not include the city council-approved new departments in his budget proposal for the next fiscal year. The mayor said he believes that any issues can be handled with current staff and perhaps some new hires.
But I did give it a lot of thought over time, and I think that we have a pretty amazing city in so many ways, and this may not be really the time to discuss some of those things, but I think you go down through every department in our city. It's extremely responsive to a very diverse community that we have. I think a lot of the things that are happening in our community happening organically. I mean, you think about FIDU, the first really Asian American department head. We have Marley Casley, who's the first, I guess, Albanian American. So we're seeing a reflection more and more in the city employees of what our population is. And I always go back to the schools and go back to the police because those are the two most visible, I think, that the public deal with on a regular basis. And I tell you, we get dozens of different languages spoken in our schools that come from all over the world. And every family is treated with class, with dignity, with respect, and we do an awful lot. So I certainly appreciate Councilor Palmucci's comments. I appreciate the council's wishes. I'm just not there yet, and maybe we'll get there.
That new mayoral committee will be tasked with exploring whether Quincy needs a separate Department of Social Justice and Equity, and then issue a report later this year. Quincy City Council will begin reviewing Mayor Thomas Koch's proposed fiscal year 2022 budget soon. The $346.6 million spending plan represents an increase of about $6.4 million over the current fiscal year's budget. City Council President Nina Liang says that examining the budget is the single most important thing the City Council does.
And the mayor had created a funding source for that to make sure that there were, it's not a large amount, but making sure that there's an allocation this coming fiscal year for language access for all departments. So again, this is not just translation services, it's also making sure that all of our meetings, whether on Zoom or in person, if we're back in person again, that they're all ADA compliant as well. So moving forward, this will be a standing resource. We will reassess after, the sort of mid-year check-in with that, and then moving forward to the next year's fiscal year, we'll take a look and see, was this helpful to each of the departments? Do they need more? Do they need less? And to see, based off of the research and what we've seen this last year, in addition to the next 6 months, what is a good number moving forward to make sure that we are accessible, both in language and ADA compliance to residents who need it.
Now, the budget proposal assumes the City Council will approve bonding $475 million to pay off the city's pension obligations. The mayor says the move will save the city millions of dollars every year, but he says if that bond fails, the proposed budget would increase by at least $14 million this year. The former Louis Restaurant on C Street in Quincy is coming back under a new name. Board of License Commissioners this week approved of what will be called the Off the Hook Bar and Grill. Quincy Building Inspector Jay Duca led this week's meeting. He said the proposal has the support of the neighbors.
They've had these licenses for years. Louis has been there for years. It was well received by the neighborhood. There was a lot of people in favor of it. I was surprised to see that many folks online supporting it. By all accounts, he runs a great place up there. John Gallagher, and we wish him the best. And nothing much has changed with the rest. He's cleaned it all up, and I think he's planning on open by July, hopefully. So yeah, that was the former Louis Restaurant, and that'll be opening soon.
John Galligan will continue to own and operate the new restaurant. Galligan closed Louis back in 2018 after severe storm damage. He tried to sell his parking lot to raise funds, but neighbors sued, citing concerns about potential development. Finally, there are two new members of the Board of Directors at Mannett Community Health Center here in Quincy, Karen Ward of Quincy and Donna Marr from Weymouth. Ward currently serves as a compliance manager for the Bill and Melinda Gates Medical Research Institute. She was a neuroscientist for Pfizer Pharmaceuticals. And Marr is a retired healthcare executive who spent almost 20 years at Morton Hospital in Taunton. Mannett Board President Robert Griffin praised both women for their expertise, saying they understand the vital role community health centers play in Quincy. Coming up, representatives of the Mobile Integrated Health Program at South Shore Health in Weymouth. That's next.
I was vaccinated.
I got the vaccine.
I am fully vaccinated.
I feel safer. Enjoy your lunch. It's about protecting not just yourself, but the people around you.
The vaccine is safe.
I did my own research.
Trust the wisdom of the people preparing the vaccine, testing the vaccine.
It's the best way to get us back to a more normal way of living.
Friends that didn't want to take it before, they were like, oh, well, you're fine. That means I could be fine as well.
I'm protecting my family,
Neighbors, coworkers.
my patients. Trust the facts. Get the vax.
Hi, we're the Quincy Fire Department, and keeping everyone safe in Quincy is our top priority. And that's why we're teaming up with the American Red Cross to help sound the alarm about home fire safety.
Did you know that in a home fire you have just 2 minutes to safely escape? That's important to remember because home fires claim 7 lives every day across our country.
You can help change that. Please join the Quincy Fire Department and the American Red Cross in ending home fire tragedies by taking 2 simple steps.
Step 1, practice your 2-minute escape drill.
Step 2, test your smoke and carbon monoxide alarms monthly.
You can find more fire safety information by visiting soundthealarm.org and pledge to prepare your family against home fires.
Quincy residents can call 1-800-564-1234 to receive free smoke and carbon monoxide alarms that will be installed by Quincy firefighters starting this month.
Thank you for joining the Quincy Fire Department and the American Red Cross in this life-saving mission to keep Quincy safe.
I hear someone go, "Didn't it come from you guys?"
Strangers cough at me.
Move away from me.
Someone spit towards my direction. All the stereotypes that we've worked so hard to break are just going to be reversed. And I won't let that happen.
We all have to play our part.
I donate my plasma.
I've been making masks.
We deserve respect as much as everybody else.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse.
I'm a delivery woman, chef, a neighbor, artist,
bus driver.
I'm a doctor.
Fight the virus. Fight the virus.
Happy EMS Week to all my colleagues and friends in the EMS world out there in South Shore Hospital.
On behalf of the Trauma Program, we want to wish you a happy EMS Week and to thank you for all that you do.
84 ambulances a day come to ED. and doing the 911 service, MIH, just spectacular work.
Thank you for everything you do for us.
Thank you for all you do.
Happy EMS Week, everybody. Thank you for an incredible last year. A crazy time, historic COVID pandemic, and you guys just absolutely rocked it.
Hello, this is Mayor Bob Hedlund, town of Weymouth, and I want to take a moment to extend our best wishes to all of our emergency service providers here in the town of Weymouth and beyond on what is Emergency Medical Services Appreciation Week.
Hello, I'm Chief Stark from the Weymouth Fire Department. I want to wish all paramedics, EMTs, and first responders a safe and happy EMS Week.
We so much appreciate everything that you do on behalf of the patients, the community, and our nurses and physicians and all the rest of our colleagues.
Happy EMS Week, everybody. Thanks for everything that you do, going above and beyond.
Thank you.
Thank you, EMS, for persevering through this difficult year, and thank you for what you do every day.
You're just a remarkable team. I'm so proud of all that you do every single day, 24 hours a day, 365 days a year.
Happy EMS Week. Thank you for all that you do.
Thank you, EMS, for all you do every day. Thanks to all our EMS crew from the Girls in the Cube. Woo! Thank you.
Thank you on behalf of all 5,800 of us who work at South Shore Health for what you do every day. I want to take time on this special Appreciation Week to thank each and every one of you.
Thank you. Thank you, EMS.
So we're really happy to welcome to the program today from South Shore Health's Mobile Integrated Health Program, the coordinator for that program, Pat McGovern, and also paramedic Julie Abuzaid is here because this is National EMS Week. So Pat, Julie, nice to meet you both, and thanks for spending some time with us. Really appreciate it.
Thanks for having us.
It's our pleasure. We've heard about this program at South Shore Health in the past, Mobile Integrated Health, and I know that you are very much first-line responders, particularly during this pandemic. But Pat, maybe if you could tell us a little bit about what it actually is.
Sure. So Mobile Integrated Health went live in March of 2020. The goal was to kind of provide access to the patients that don't necessarily have the ability, don't have a primary care, don't qualify for VNA services, kind of patients that wouldn't qualify for services otherwise, in an effort to try to help them stay home, help them with their care, and help them try to avoid ED visits so they don't have to be coming to the emergency department for all of their treatments. Be able to help them at home at no cost to the provider.
So, I mean, really, it got up and running right when the pandemic hit. Was it founded because of that, or was that just happenstance?
Right. Well, yeah, that's the common question. You think we predicted the pandemic? No, we have been working on this for about 10 years now. It was a program that took a lot of time, a lot of work and effort with the health system, and actually changing some laws that prohibited some of these things from happening in the world. So we've been working on it for quite some time. We just happened to launch it a month before COVID happened, and then COVID hit, and we had a program where paramedics are able to go out into the field and see patients in the field and help them stay out of the hospital. And with COVID, what better program to utilize for that kind of a pandemic? So we changed our program a little bit, got a couple waivers, and functioned with COVID in mind as well. As our other patients, we still had our other patients that we saw routinely. And we also had these patients that were diagnosed with COVID. With everything happening, there's flow issues with the hospitals. Patients were filling up the hospitals with COVID. So we decided to figure out what we could do to utilize Mobile Integrated Health to help the COVID population that needed treatment, but necessarily didn't really need to be in the hospital, that could quarantine in their own house. So how do we treat those patients? And we had actually had a great department in mind. We had just started.
Was that a scary time?
Definitely, yeah.
Definitely.
Not more the paramedics than me. I was there creating the protocols and helping them out, but, I was with them seeing patients, but these paramedics were seeing a lot more patients in the house. It was obviously a new pandemic. It was nervous for everybody. And now you have a paramedic going into a house and treating a patient by themselves. They had telehealth with providers, so they were able to talk to physicians and our APCs on the phone through Zoom. However, they're functioning alone. At one point, we ended up, during the height of it, allowing another EMT to go with them to help them with their deconning, to help them with equipment, to help them with all of that stuff. But they were still in there treating these patients alone.
Julie, as a paramedic, did you ever envision yourself being, a first responder on the front lines of this pandemic?
No, this was nothing that was expected. But I think us as a group, we managed to handle it, and be supportive of each other and take everything in with stride.
What lessons have been learned over the past year, Julie, would you say that, that will continue in the mobile integrated health program in the future?
The mobile integrated health is a comprehensive way of treating our patients. It's more an advanced level of care that we're able to provide for our patients in keeping them home and not utilizing the emergency room and keeping them free to handle the more critical patients. And with the mobile integrated health program, I think this is the way it's going to be seen in the near future, and providing services for our chronically ill patients, like Pat said, that can't make it into the hospital for whatever reason, that we're able to treat them at home and giving them the ability to stay at home and feel more comfortable, and with us providing the services for them.
What has been the reaction of your patients to this program?
I've got nothing but positive feedback. Julie sees these patients in the houses, but the letters that I get, the phone calls from the families, the gratitude. I'd only treated a couple of patients in the field COVID-wise, but every patient was just grateful to be home. The biggest thing, some of the patients said, it's just nice to be able to lay in your own bed and shower in your own shower. You take that for granted when you're in a hospital for 7 to 10 days getting treated for COVID. You miss the little creature comforts of home.
Pat, how many actually staff do you have in the program, and did you have to increase it because of the pandemic?
We did. Our original plan called for one truck, 12 hours a day, so that hired 3 paramedics in the beginning. With the COVID pandemic and the expansion, we were able to hire a total of 16 paramedics right now. We run 2 trucks 7 days a week and 1 truck 5 days a week. And we also were able to onboard 13 advanced practitioners, so PAs, nurse practitioners, to help out as well with conferencing with these paramedics in the field, being able to give live orders as to how to treat these patients right away in the field, in their houses. So they had that to reach out to as well. So our program expanded from 4 paramedics, 2 physicians, and myself, to 16 paramedics, 13 providers, and 3 trucks. So as a coordinator, it grew rapidly. I was a new manager at the time, and all of a sudden, we're tripling the size of the department.
Yeah. Do you anticipate it growing further in the future?
I do. I think we're going to grow a lot more. The need is there. The COVID treatment, all that stuff is kind of starting to wind down. But we still have those chronic patients that we do see. And now that the program is out there, we get referrals daily from physicians' offices and outreach firms for people to get seen and get treatment through MIH.
What is your service area, basically? Where do you see patients?
For the most part, it's the health system service area. So it's up to Quincy, down to Plymouth. It's whatever the health system services.
And is there any kind of specialized training that's required for your paramedics to work on this particular unit?
Yeah, so initially the paramedics, the initial 3 paramedics went through an advanced training that I put together. It was 300 hours of what we called clerkships. So we did 80 hours of in-class training where the physicians actually came and talked about their practice, talked about their specialty, and then the paramedics did 220 hours in the field with those providers, just doing training with the physicians, seeing patients in their clinics. With the rapid rise, we're still working on the training. There was some adjustments we made, some learning that we want to increase training in certain areas that we're seeing more of, and decrease in other areas. So the newer paramedics, since we had that spike with COVID, are getting pulled off the truck and sent through training as the availability is there. So we do have a special training. Just like I said, it's more for the specialty that the providers are in, so they can get more hands-on than what their paramedic program gave them.
Now, did COVID impact your staff at all?
I don't believe so. No, I think we only had one, maybe, if that. But the good thing, I mean, the difference is with mobile integrated health versus like an emergency paramedic. Emergency paramedics obviously take their time getting in the house. But all of these appointments that we have are pre-scheduled. So we could take a little bit more time making sure that the equipment is there, making sure that they're putting everything on properly. That PPE buddy that we sent out with them for a while was able to help them decon and help them take care of everything. So everything was a slower process. So it didn't really affect our department.
Julie, what do you find kind of most rewarding about this particular assignment?
For me personally, it's having that one-on-one relationship with the patient that you're seeing, and you're able to provide the care that they need without, like Pat had said, when you're on a 911 truck, it's you go in, assess, and then you're transporting the patient. But with us, we have the ability to sit and, assess and evaluate the patient a little bit more than we would if we were on a truck. And I think that's more rewarding because the patients appreciate you taking the time, listening to them, and able to treat them at their home and giving them the ability to stay there. And family members appreciate it because if they were home, they can care for the patient instead of having them sitting in a hospital bed. They're able to at least see their family members and provide for them as well. So I think that's the most rewarding, is just being there for them and providing the services at their level.
Yeah. Do you develop relationships? Do you get to see the same patients, multiple times so you get to know them?
You can. There's quite a few patients that we see, as Pat said, that we're seeing the chronically ill type patients, and they're seen frequently, whether it's on a monthly basis or patients who require certain treatments like antibiotics, that you see them over the next 7 days. So you do build a relationship with them.
Pat, was there any specialized equipment that was needed in the units for this particular program that didn't exist before?
We did have some expanded scope medications for certain things that you wouldn't normally carry on an ambulance. For the most part, the trucks are staffed with everything that an ALS ambulance would have, a 911 ambulance would have, but with a little bit more expanded scope equipment. But there wasn't anything major that we had to add to the trucks. Just some of the drugs, some of the antibiotics that you normally wouldn't see in an emergency setting would get added to this so we could spend more time with the patients.
Yeah. Now, is this the same type of program where you have telemetry with the hospital, while you're at the scene? Yes.
Yeah. So all of our cardiac monitors can actually send the 12 leads directly to the physician that's treating the patient. We have Zoom through phones that we can Zoom with the patients and the providers to talk about what they want to do and what treatment plans they want.
Yeah.
But for that, mostly it's just normal stuff that you would see in an ambulance.
Is this, being replicated anywhere else? Is this a model, do you think, for other health systems?
We were the first in the state to do it. There aren't many throughout the country. It is a popular idea throughout the country, but the idea of mobile integrated health is more focused on your population. So what we're doing in Massachusetts wouldn't be the same program that they're doing in California. So I have talked to other programs, but it's, like I said, it's geared more towards what your health system is seeing is a gap in care. So where you can pick up that area.
Right. I can see it being a real benefit in, say, rural areas or less populated areas where folks don't have access.
Right. I actually toured a facility in Wisconsin, and their program was the same. Like, they had a rural kind of area that they would see that they had tough access to care. So their paramedics were focusing more on that primary care aspect because they couldn't get those patients to the physician's offices.
Yeah. So this is National EMS Week. So is the Mobile Integrated Health Program at South Shore Health doing anything special for National EMS Week?
Yeah, we're doing daily raffle prizes. Food trucks are coming by the garage for the paramedics and the EMTs. We have a couple events scheduled throughout the week.
Okay.
As safely distanced as we can with COVID.
Of course, yeah. Let me ask you both, given the governor's announcement recently about the restrictions being lifted, how does that make you feel, after coming out of this last 14 months?
Good.
For me, I think it's a little bit more of a relief that we're able to do a little bit more, but still, I'm a little bit more skeptical that I would jump into it without wearing a mask. And I know here at the hospital, that's still going to be a mandated thing that we would have to wear masks. But I think trying to get back into some kind of normalcy is nice, especially with the summer coming up. But I think everybody still needs to be a little bit more conscientious of what's out there.
Sure. How about you, Pam?
The same. It's nice to be able to get out. But, being on that healthcare side of thing and seeing those patients that dealt with COVID, obviously on my job, it'll be more of a second going to right away with a mask than I've thought about in the past. So that'll be more for my day-to-day routine. Just kind of being skeptical. You still want to be prepared, but it is nice to be able to get back to some sense of normalcy.
Sure. Julie, for somebody who may be considering joining the Mobile Integrated Health Program at South Shore Health, what would be your advice to them?
I think it's a great program. I think there's a lot of benefits that can be provided for these patients. If it was my family member, it's something that I would strongly suggest. And like Pat said, it's just being the ability of staying at home and being within your normal settings. I feel that people heal a lot quicker and faster being at home than they would if they were in a hospital. And like I said, this is something that's going to be coming more use of with us, and I think it's a great program.
How about yourself, Pat?
About the same, honestly. The providers that we see are the ones that have had, the years of 911 and lights and sirens, and they're ready to just kind of take a step back and relax and spend time with the patient. To Julie's point, there's a lot of literature out there about rehabbing at home, and just a comfortable environment helps patients, and being able to have that care in the house is amazing.
Yeah, and I know there's a financial impact here too. We really haven't talked about it. It's keeping people out of the emergency room, right? So, which is a very costly procedure, sure.
Right. So that benefits both, not only the health system, obviously, because it decreases the flow, but it also benefits the patient, because the last thing anybody wants to do is have to sit in an emergency department.
Yes.
So cost savings on both ends between the patients and the system.
How is it determined who gets mobile integrated health? How do the patients come to you?
Right. So the biggest thing is we try not to duplicate services. So our goal is to try to hit that population that don't qualify for other services. So we have had referrals come in that we've had to say, well, you do have this ability to use this through this program. Programs are out there, they're funded, they should be utilized properly. So we do evaluate every patient that comes in. Like I said, our goal for the patients that we would take on or would participate in the program are those patients that, may be homebound, that don't have the ability to access care, that can't get to their primary care's office, that, don't have insurance that can cover VNAs to come out visiting nurses, because, VNAs, they do an amazing job with patients on a daily basis. And they have an amazing program. We don't want to take that away from them. So we want to try to gear towards those patients that don't have those areas of coverage.
Anything else either one of you'd like to add?
No, I think that's it.
Well, we want to, as part of National EMS Week, thank you both for all you've done over the past year plus during this, unprecedented crisis. Now they're coming on the other side of it, and we're really grateful to have you as part of our healthcare system here on the South Shore.
Well, thank you for having us.
I appreciate it. Thank you.
It's our pleasure. All right, be well.
Thank you.
Thanks, you as well.
special thank you to Pat McGovern and Julie Abuzaid for joining us today. Thank you to our crew, and thank you for watching. And a reminder, please visit our website at qatv.org. You'll find our latest programs there, along with news and information, video on demand, live streaming, and much more. For all of us here at Quincy Access Television, I'm Joe Catalano. Please stay safe.